Hello, everyone. Hi, good evening, everybody. Thank you for joining me here again tonight. We're going to have your Facebook Live again, focusing on delegation and prioritization. So, thank you very much for joining me, everybody. And tonight, I have prepared some few questions for you to practice on delegation and prioritization. Okay, and also for tonight, very special as well, is we have a simple contest for tonight. Anybody who wins for tonight will get a free 90-day online NCLEX review that's going to be for free, and 90 days online NCLEX review with our Matus Nursing Review online NCLEX Academy. So thank you very much, everybody. I would like to greet some people that are joining us tonight. So we have Marela. So she's our special student, of course, and she's joining us again for tonight. And then we also have okay, so Fresel again. Okay, so Fresel is also here tonight. So thank you very much for joining us again. Also Pratiksa. Okay, so hopefully you can hear me. All right, and then we also have Induka as well. So I hope that these are going to be the future nurses. Okay, so for tonight, as what I have said, we're gonna have a contest, and the contest is going to be that you're gonna be putting your one answer on the comment section. So whoever puts the answer correctly on the comment section, the first person, then that person will be the one winning our prize tonight. So I'm gonna be asking one medical surgical nursing question, and then I want you to answer. So you can also Google the answer if you want. So, and then whoever wins can also transfer this to anybody. So it's a 90-day free online NCLEX review course in our Matus Nursing Review online NCLEX Academy, and that is worth $129 actually. Okay, so we're very excited for that. So, but before anything else, before I start for tonight, I would like to greet one person tonight, or send a congratulatory message for this person, and that is Ruela. So Ruela is our recent NCLEX-PN passer. She passed her NCLEX exam, and she's been my student and one of the dedicated ones. And really, congratulations for finally achieving your dream. You're finally licensed vocational nurse in California. So I'm very happy for you. And if you don't know, also Ruela is also going to take an exam, the NCLEX-RN exam, soon as well. So we'll find out if she's gonna have two licenses, and that's gonna be a double celebration. So you have an LVN license, and at the same time you're gonna have an RN license. So that's really awesome. So thank you very much. And also, again, yes, congratulations, Ruela. I have also invited her to join us next week. So probably she's gonna be our guest here to share with you some of the tips and strategies that she used to pass her NCLEX examination. Okay, so congratulations, Ruela. So for tonight, let's greet some people here who's joining us. So send me a very good message for tonight, everyone. So yes, Induka is greeting Ruela for passing her NCLEX examination, and that's really very awesome. That's one of the things that I really like about doing what I do, because I help students achieve their dreams, and I know that in a way that also changes their lives as well. So congratulations. Now, also we have we have a lot of people joining us tonight, and so far I'm very happy because the feedback with this Facebook Live has been so awesome. A lot of students have been emailing me and really wanting to watch the videos, and they're saying that they were really learning a lot. And I think that the good thing about this Facebook Live is the fact that we're focusing on delegation and prioritization, which is again, as I'm saying, it's a big chunk of your NCLEX. It is something that it's really very important to master before your NCLEX examination. And of course, I promised you that in the next few weeks, I'm developing a program to really help you master this concept on delegation and prioritization. Okay, so for tonight, before I proceed with our first question, I would like to share something. This is something that a student has sent me recently, an email, and she said that she's really very happy that she bumped into this acronym that I give students in YouTube. And she said that, Sir Alan, I really like this acronym that you're giving, because I think this is really very important to remember for the NCLEX. And this acronym is actually the ABC roadmap to NCLEX success. So usually I share this with students, and I tell them that you have a very simple formula to pass your NCLEX, and that is going to be your ABC. A stands for actually your attitude and determination. So that's really number one. I tell students that in order for you to really succeed in the NCLEX, it's really very important that you have a study plan, that you're motivated, and that you put more hours to study and prepare, because that's really very important. So again, attitude and determination and the motivation is really very important, because studying for the NCLEX is challenging, and you need to make sure that you have a clear goal and that you are focused, because there will be a lot of distractions, and you want to make sure that you're prepared for that. Okay. Letter B is the basic core content mastery. So I've always told this to the students: do not work backwards. Okay. The sub students will just tell me that, oh, Sir Alan, I just love critical thinking questions. I like analysis questions. I like application questions. And I would tell the students, but if you don't know your content, then how can you achieve your skills, or improving your skills on analysis and critical thinking questions, if you don't even know simple definitions or simple pathophysiology of disease conditions? So you have to solidify, and you need to master your content. You cannot be a walking encyclopedia when you take your NCLEX. I always tell students that, but you at least need to know what new graduates should know. You need to know that what are the important concepts, the key concepts that you need to know for the NCLEX. You cannot know everything, but at least you need to know your basic concept for the NCLEX examination. Okay, and the last one, the letter C, is going to be the critical thinking and test taking skills. So of course, once you know your basic core content mastery, then you can be able to improve your skills on critical thinking. Now you can practice thousands of questions. So I always advise students that before you answer practice questions, you need to study the content first, and then you read the practice questions, so that in a way you'll have more ideas. Okay, and you'll be able to apply the knowledge. Okay, so I hope everybody agrees with me. I'm not sure if you like this ABC. If you want, then you can make a comment in the comment section if you like to apply this in your preparation for the NCLEX, everyone. So who agrees with me with the ABC? So put that in the comment section. All right, so don't work backwards. Okay, it's always ABC: your attitude and determination, your basic core content mastery, and then the last one, that would be um, your critical thinking and test taking skills, and that would be your NCLEX success. Okay, so remember this, everybody. Okay, so are you ready for our first question for tonight? So we have a lot of people that are here for tonight. Okay, so we have Kirk. Okay, oh, that's really very good. Hi, Kirk. Oh, so you passed already your NCLEX, so congratulations. Oh yeah, very good. Okay, so congratulations. I think I met you before in the Philippines, and congratulations. Maybe my book has helped you. So thank you for joining us tonight, Kirk. So congratulations for passing your NCLEX RN. Okay, so we also have Bay Kikil. They said that yes, agree. Motivation is highly important. So when you work in a hospital, people will not ask you how many times you took the NCLEX. That's not the most important thing, because you don't want NCLEX to define you what kind of nurse you will be. You can still be the best nurse, okay, even though how many times you took the NCLEX. The most important thing is every failure should be a learning opportunity, and always remember that the NCLEX is an examination, but the practice will also give you the opportunity to be a caring nurse. So just remember that take it as a learning opportunity, as a motivation that you will be the best nurse once you pass your NCLEX examination. Okay, because the NCLEX is important, because it is an exam that will test if you're going to be a safe nurse. So it is an opportunity to improve your skills, okay, and your knowledge as well. Say. So let's proceed now to our first question. So we have all the students, they're joining us, and I know you're very excited with our first question for tonight. So my first question for tonight is going to be on, okay, is going to be on delegation, everyone. So let's see who can answer questions on delegation. So I'm gonna have 4 questions for tonight, and then in the middle of the questions, I'll be throwing out one question, and then if you're able to give me the answer correctly, and you're the first one, then you'll be the one winning our 90-day free online NCLEX course. And the good thing about this online NCLEX course is that you can actually transfer this to another person, and this is worth $129 in our online academy. Okay, so first question for tonight is going to be on delegation, everyone. So I'm going to share this question, everybody. Okay, we have one person here. Okay, thanks, Maria Valencia, sharing this live review. Very good. Thank you, Paul. Okay, so the first question is going to be on delegation. So again, as what I have told you, that the goal of this Facebook Live is not to memorize the questions. In delegation and prioritization, the approach is always knowing the principles, because you're going to be applying them and you'll be analyzing each question. All right. So our first question for tonight is going to be on delegation. Okay. So this question is about the unit charge nurse is assigning tasks to the licensed practical nurse and unlicensed assisted personnel, or UAP, or in California you call them the CNA. So which of the following delegated tasks should be questioned? Okay, so A, asking the UAP to empty a client's Foley catheter bag. B, instructing the LPN to apply a medicated cream to a client's stage 2 pressure sore. C, telling the UAP to check the color of the urine of a client with suspected urinary tract infection. Or D, requesting the LPN to administer the fleet enema of a client admitted for constipation. So for example, I would like you to think right now, you're in the NCLEX, you're in the middle of the examination, and you're answering this question. So what do you think is going to be your answer? So we have a few people who's giving their answers now. Okay, some people are telling us C, some are saying D. So what will be the answer? So I will tell you one thing, everyone. When you're delegating again, always remember, if you're the charge registered nurse, for example, you always have to delegate someone who is stable. Always remember that it's within the scope of practice of the person. And the last one is the person has the skills for that. So remember the three-letter S's: the scope of practice, the skills of the person, and then also the last one is it a stable patient? Okay, especially if you are the registered nurse who's delegating this to the UAP and the licensed practical nurse. Okay, so some people answered letter C. Okay, so Marella answered letter C. We have my answered letter C. And why do you think is letter C the answer? So let's try to dissect the question. Okay, let's try to dissect the question. Why is C maybe is the answer, or maybe letter B? So remember, so when you're delegating here, okay, so letter A, asking the UAP to empty a client's Foley catheter bag. So that's actually within the scope of practice of the UAP, emptying the bag. Okay, the question says, which of the following delegated tasks should be questioned? So this is an example of a negative question. Okay, so in the NCLEX you have two types of question. Most of them are positive questions, and this one is a negative question. And when you say it's a negative question, it means that you're looking for the wrong one. Okay, so the other options are correct and you're looking for the wrong one. And examples of negative questions will be questions that ask you, for example, like which one requires reinforcement, further teaching. So those are examples of negative question. So again, when it's a negative question, you have to be careful a little bit. So we're looking for the wrong one in this option. Okay, because it says which of the following delegated tasks should be questioned. So meaning what is wrong. Okay, so we have letter A, asking the UAP to empty the Foley cath, and that's okay. That's within the scope. All right, and then letter B, instructing the LPN to apply medicated cream to a client's stage 2 pressure sore. So is that correct, or is it something to be questioned? Your letter B? I don't think so, because letter B is within the scope of practice of the LVN or the LPN to apply medicated cream, right? Let's go to letter D, requesting the LPN to administer the fleet enema. So fleet enema, of course, as an LPN, you are trained to give a fleet enema to your patient, especially as a patient with constipation and stable patient. So the answer to this question actually, everyone, is going to be, of course, that's correct, everybody. So the answer to this question is going to be letter C. Very good. So letter C is the answer. Why is it that letter C is the answer? Okay, so Manuska said that the lab indicates that there is an infection going on. And also remember that when you're delegating, you have to be careful, especially if you're the RN. Remember what we said the last time, do not delegate EAT. EAT means evaluation, assessment, and teaching. Now, letter C is an assessment. So that's why you cannot delegate this to the UAP, because checking the color of urine is a form of assessment, especially in a patient with urinary tract infection. Things that you delegate to the UAP, remember this, should be something that is simple and routine. Okay, so it has to be routine. You don't delegate anything that requires complex thinking. When you delegate to the UAP, you should focus on the task, okay, not the thought. Okay, not the thought. So you don't want to delegate anything that will require thinking or assessment or monitoring or interpretation. Okay, the same thing to the LPN. So letter C is the answer, because we do, of course, it is not correct that we ask the UAP to check the color of the urine, because the color of the urine, it could be very simple, but in this situation, it has to be the charge nurse checking that. All right. So the answer is going to be letter C, everyone. Congratulations. That's good, everybody. You got the right answer. Now let's go to, okay, so the next one will be another question that we have for delegation again, everyone. So this is delegation. So let's read the question and let's see if you can answer this question again, okay? And again, as I promised, in the next few weeks, I'm developing a curriculum that in one sitting, in one session, you will know the principles of delegation and prioritization just in one sitting. Okay, so I'm developing that program, everyone. So let's have this question. The charge nurse in the orthopedic unit works together with a newly licensed practical nurse or LPN. Which task would be most appropriate to delegate to the LPN? Is it A, evaluate the pain level of a client admitted for fat embolism? B, irrigate the wound of a client with severe osteomyelitis of the foot? C, check the milk tray of a client with renal failure for appropriate diet? Or D, perform an assessment of a client admitted for a left femoral fracture? So which one can you delegate to the LPN? So if you're the registered nurse, which one will you delegate? If you're the LPN, which one will you accept? Okay, so is it going to be A, B, C, or D? So which one can you delegate to the LPN? All right. So which one is the safest one? The safest one. Okay. Is it A, B, C, or D? Okay. Which one can you delegate? All right. So is it A, B, C, or D? Okay. So the answer to this question is going to be very exciting, everyone. It's going to be very exciting. Okay. So which one is appropriate to delegate? Okay, so let's go to the, okay, let's go to the, okay, to the question again. Okay, so the question is all about delegation. So letter A, so of course letter A is wrong because it says evaluating the pain level of a client admitted for fat embolism. So of course definitely that's wrong, because evaluating the pain level is the responsibility of the RN. Am I right? Then you do have letter D as well. Perform an assessment of a client admitted for a left femoral, what's this? Left femoral fracture. Then also we have letter B, which is irrigating the wound of a client with severe osteomyelitis of the foot. So is that something the LVN can do to irrigate the wound of the client? And then letter C, check the meal tray of a client with renal failure for appropriate diet. So what do you think is the correct answer to this one, everyone? Definitely, we're going to eliminate letter A because it says evaluating the pain level of a client. We eliminate letter D. Now we have letter B and C that's left in this question. So what do you think is the answer, everyone? What can you delegate? Okay, B and C. Is it within the scope of practice of the LVN or LPN to check the meal tray also, okay, of the client to find out if it's the correct diet for the patient? Okay, can the LPN do that? Or letter B, can the LPN irrigate the wound of a client with severe osteomyelitis of the foot? Okay, so what do you think is the best answer, everybody? So we're getting answers here tonight. Okay, most of you answered letter what? Letter B. So will this be the answer to the question? Okay, so remember, you have to delegate the most stable task here. So remember, the answer to this question is going to be actually letter C, everyone. Okay, so we remove this. So we are going to have now, okay, so we're gonna have letter C is the answer actually to this question, not letter B. Okay. So why is letter C the answer, everyone? Now letter C is a responsibility that you can delegate to the LPN to check the meal tray. You don't have a UIP at this time, okay, but you can delegate this responsibility to check the meal tray of a client with renal failure for appropriate diet, especially you're talking about diet. So you want to make sure that it's the right. If you assign this to the UAP, this responsibility is you have to make sure that it's the right diet and then you have the right foods in the meal tray. So when you're talking about renal failure, they have specific diets. And the LVN can do that, can screen out which one is supposed to be included in the diet. Letter B, irrigating the wound of a client with severe osteomyelitis. That's a responsibility of the LVN as well. To LPN, they can irrigate the wound. But remember, the situation here is severe osteomyelitis of the foot. Now, when you say severe osteomyelitis of the foot, maybe the RN can do that actually because it's severe osteomyelitis of the foot. So, meaning that that is something the RN should be handling at this time because that patient is having severe osteomyelitis. Okay. Now, if you're going to look at letter B, if C is not there, then you will choose letter B definitely. That would be another option. But then choosing between B and C, C is more acceptable, everybody. Okay. You cannot delegate your letter C to a UAP because this is a renal failure patient. And then checking the meal tray for appropriate diet, you have to make sure that they have the right foods in that meal tray. Okay, what if you have bananas there? What if you have the UAP may not be able to really know what are the appropriate foods included in a renal diet. Okay, but then the LPN has that capacity to evaluate or to, let's say, just to check if it's the right foods for your patient. Okay, all right. So letter B has severe osteomyelitis. So that is something that you have to think. All right. Now, irrigating the wound is the responsibility of the LVN or LPN. But again, what I'm saying is that always use the process of elimination. Okay. In this situation, the answer is going to be letter C, everyone. Okay. Very good. So let's proceed now to the next question. This will be your um, prioritization of everybody. Okay. So let's see. Okay. So someone said there, oh, okay, since the B is severe, it's not stable. Yes, exactly. That's what we're saying. Yes, because it says the word severe osteomyelitis. Okay. All right. Very good. So let's proceed. Now, we have here a number three, a prioritization question, everyone. And this one is really one of the things that nurses struggle in terms of what is the next best action or priority nursing action. So let's have the question, everybody. Okay. So the unlicensed assisted personnel, UAP, reports to the registered nurse supervisor in the subacute respiratory unit that a client's tracheostomy tube came off and got disconnected from the ventilator. Which of the following is the priority nursing action? This is a very common scenario in the NCLEX wherein the UAP reports to the RN or the LVN reports to the RN. So what is the first thing that the RN is going to do? Or if you're the LVN charge nurse, for example, or LPN charge nurse in a skilled nursing facility, what are you going to do if the UAP is reporting you something? Is it A, find an extra tracheostomy tube set? B, call the rapid response team? C, check the client status? Or D, tell the UAP to get the crash cart? Okay, what do you think is the answer to this? So this is a situation wherein the UAP says, okay, RN, the client's tracheostomy tube came off and got disconnected from the ventilator. So what will you do first if you're the registered nurse? Okay, is it find the tracheostomy tube set? B, call the rapid response team. C, you're going to check the status of the client. D, tell the UAP to get the crash cart immediately. So what do you think is the most important response here? Okay, what is the most important? What is the priority nursing action or the most important action here? Okay, so let's dissect the question. Let's analyze it, everyone. Okay, so in this situation, what are we going to do now? Okay, so when the UAP reports something to the registered nurse, you as a charge nurse or registered nurse should verify the information. You should go there and check first. Okay, what's going on? All right. So you want to find out, what really happened. So letter A, find an extra tracheostomy tube set. You're wasting time there, okay? Because more likely, if you have a trach patient, by regulation, they usually have an extra trach set at the bedside, okay? B, call the rapid response team. So why do you have to call the rapid response team when you don't even know what's going on with your patient? Letter D, tell the UAP to get the crash cart. Yes, maybe, but is that really the priority? So always remember in the NCLEX that you always have to be focused on your client, okay? Always the client first. It has to be client-centered. So the answer to this question is going to be what? Okay, letter C. The principle behind this question is this: whenever your subordinate or your team member reports to you something, the first thing you have to do is to check first what's going on before you respond. You have to go there and you have to find out what's going on, especially what's going on with your patient. And always remember the principle that we have in the NCLEX, okay? Always patient before equipment, okay? Always patient before equipment, all right? We don't want to check the ventilator. We want to check the patient first, okay? What's going on with your patient? And especially in this situation, you want to check the airway of your patient. And then after that, if there's distress going on, if there's an emergency, then you really have to do the next step, which is to call for help or to do intervention immediately to save the patient. Maybe you have to give oxygen, maybe you have to reinsert or another tracheostomy tube to your patient, but you have to find out what's going on with the patient first. So let's see, the answer is going to be letter C, everyone. So Manuska, you got that right. Very good. So very good. So check the patient first. All right. And then we also have Induka. Yes, congratulations. Okay. Very good, Nisha. You got the right answer. Very good. Okay. And then my also letter C. So I hope you get the right answer as well. And I know that in the NCLEX you will have situations like this, everyone. And you have to apply the principle. Okay, always your patient first, check them first. And if your patient is in distress or emergency, okay, don't waste any time. You have to do something first. All right, calling the physician may be done later, but you have to do something first. It's your patient safety first. All right. Okay, so let's proceed, everybody. Let's have the last question for tonight. But before I show you the last question for tonight, I'm going to reveal the question for tonight, and you have to type it. There's only one word, okay, that you have to answer, okay, in this question. I'm gonna give you a clue. Everyone. All right, and then you have to type as fast as you can, and then you put the answer in the chat box. Okay, so the question starts with letter H. All right, the question starts with letter H. All right. So, are you listening, everyone? Because I'm going to ask the question. And this question is related to the next question that we have. So, all right. So, this is a question. It starts with letter H, one word. In which procedure, okay, can a patient develop or experience disequilibrium syndrome? In which procedure can a patient develop or experience what you call disequilibrium syndrome? Okay, it starts with letter H. So what do you think is that procedure? Okay, what procedure? Okay, it starts with letter H, everyone. Okay, where the patient can develop or experience what's this? This equilibrium syndrome. And obviously, we have a winner. Congratulations. Okay. So, congratulations, Janine. You just won a 90-day online NCLEX Academy access to our Matus Nursing Review online NCLEX Academy. Congratulations, Janine. So, you got the right answer. That will be your hemodialysis. And hemodialysis is a common question in the NCLEX as well, a concept. Okay. Hemodialysis, your disequilibrium syndrome. Very good. Okay, so congratulations. How can you get your award? What you can do is send us a message, give us your email address, and then we can email you about the details of the award. Okay. If you live in the United States, I'm going to tell you one thing as well. If you live in the United States, I'm also giving you a free copy of my ebook. Okay. So that ebook is something that you can use to review for your NCLEX. Okay. So again, I'm giving you a free copy of my ebook if you live in the United States. Okay. So congratulations, Janine, for that answer. And then also in our next Facebook Live, we may be giving away another prize as well. So tell your friends because we're going to be doing this constantly. Our goal is just to really help the students. Congratulations. Okay. All right. Thank you. Yes, Janine. So you just won. Okay. In the name of passing the NCLEX, we'll do everything, everybody. And Ray also says congratulations as well. Okay. So, to my Matus Nursing Review Facebook group community, thank you very much for being here tonight. Okay, we're gonna have the last question, everyone. Okay, so our last question for tonight is gonna be about prioritization again. Okay, so in this question, okay, this is again a common concept in the NCLEX. So our focus for prioritization tonight is all about what's the next best nursing action. Okay, so let's proceed. So the question is going to be, all right, so we have, okay, so a lot of congratulations for Janine. Thank you. So join again everybody next week. I'm going to give you a clue on what will be the possible question in our contest, okay, so that you can prepare. So the question for tonight, our last question is going to be on, okay, prioritization again. So a client who is receiving hemodialysis for the first time suddenly develops headache, nausea, and seizures. Which of the following is a priority nursing action? Is it A, administer diazepam or Valium, B, discontinue the dialysis procedure, C, slow down the dialysis procedure, or D, administer 100% oxygen by face mask? So what do you think is the answer to this? Okay. A client who is receiving hemodialysis for the first time suddenly develops headache, nausea, and seizures. So, which of the following is the priority nursing action? Okay, are we going to give an anticonvulsant? Are we going to stop the procedure? Are we going to have to slow down the dialysis procedure? Or are we going to give 100% oxygen by face mask? So, what do you think is the first thing that we have to do in this situation? So some people are saying B, some people are saying C. Okay. What do you think are we going to do right away? Okay. So let's dissect the question, everybody. All right. Okay. So in this question, everyone, you have to look at the situation all the time. Okay. You have to look at the situation. A client on hemodialysis, headache, nausea, and then seizures. Okay, so you have your seizures, everyone. Are you going to give an anticonvulsant? This question is almost similar to blood transfusion. What do you do right away if your patient is having a reaction to the blood transfusion? The first thing that you have to do is to what? Is to stop. Okay, in this situation, you may want to answer slow down, yes, but remember, you have the situation, there's seizures going on. Okay, there's convulsions going on. So what are you going to do right away? It's not just a simple headache complaint. Okay, you have convulsions going on. So what are you going to do? So what you're going to do is to, okay, the answer to this question is going to be letter B. discontinue the dialysis procedure because your patient at this time is already having seizures and that's life threatening. If it's only simple headache and nausea, maybe you want to slow down, okay, because your disequilibrium syndrome is usually self-limiting, okay. um, Especially for first-time patients receiving hemodialysis, they're prone to develop your disequilibrium syndrome. However, this equilibrium syndrome can be prevented by slowing down the dialysis process. You can prevent that, okay? And also, your disequilibrium syndrome happens because of the rapid removal of waste that leads to cerebral edema, okay? But then you have to look at the situation right now, everyone. There's headache, there's nausea, and then you have seizures as well. So you really have to stop. Okay, your patient is already having convulsions. So you want to stop that because maybe the dialysis procedure has been so rapid, and then you want to stop it first. Okay, so that at least you have to stabilize the patient and find out what's going on. Okay, so the answer to this question is going to be letter C. And before you give your oxygen, before you check the vital signs and everything, you have to stop the procedure because your patient is having a convulsion in this procedure. Okay, so let's see the rationalization. Okay, some people said stop. Okay, very good. Another one, stop. Okay, stop or discontinue. And it may be continued later on, probably, but you have to stop initially, okay, just to see what's going on, and of course, call for help or call the physician or nephrologist and see what's going on. Maybe do some labs, and then after that, decide how to proceed with the dialysis. Okay, especially that your patient is having nausea and then seizures. And some patients also, when they're on hemodialysis, especially for the first time, they may also develop arrhythmias as well and electrolyte imbalances. So we have to be more careful with that. Okay, so very good, everybody. Most of you answered letter B in this question, and congratulations for that. Okay, so this is the last question that we have for tonight, but then you will notice that sometimes there's a lot of things that we go over in just one question, and I hope that you are all learning with the questions that we have tonight, everyone. So again, thank you very much, everyone, for tonight. And before I end, I would just like to introduce to you again that we do have our online NCLEX Academy. So we do offer different courses, and we have students there right now, and we do have workbooks, and we have a very comprehensive program for all of the students. And we do have also live NCLEX review webinars. So feel free to check my website. That would be at www.matusnursingreviewacademy.com. Okay. And lastly, again, the same thing is I always share also my book to all the students. So if you want to check this out in Amazon, this is my book. It's a simple, fast, and easy NCLEX review book, and you can see that it is 5-star rated. So some students ask me, do you have any material that's simple to understand? Then of course I have that book for you guys. Okay, and again, for tonight, remember your ABC. Okay, so thank you very much, Manuska. Okay. Then we also have Cheryl, thank you very much. Marella, thank you very much as well. Okay, and then we have also Pratiksa. Okay, thank you very much, everybody, and I hope to see you again next week. Please join the Facebook Live, and I'll prepare more questions. Okay, more questions, and definitely questions that you will usually encounter in the NCLEX examination. So let's have some other people here. Rhoda, thank you. Okay. And then also we have Obey. So you bought my ebook. So thank you very much, Bay. And then the book that I have has been released for a while now, and so far students have been liking the book so far. So that's really very nice. Okay. Okay. So we also have, let's shout out. Okay. So we have okay, Ray. Thank you very much. Also Janine. Thank you very much. So Janine, please contact us because we're gonna give your NCLEX Academy, okay? Your 90-day online NCLEX. And also we're gonna have some holiday promos again for Nurses Week for nurses. So we may be having some discounts also for our products in the online academy. Also, we have Hilda. Thank you very much also for joining us tonight, Hilda. Thank you very much. And then I think Paul, thank you very much as well. And again, to all of the students, and please also share this Facebook Live and let the other students also watch, and hopefully that they're learning a lot as well. So again, everyone, thank you very much. Without you, I will not be doing this, and I really appreciate your presence for tonight. And next week, join me again for sure. We're gonna have another session. Okay, so thank you very much, everyone, and have a nice night, everybody. Thank you.